We come now to the Opposition Day motion in the name of the Leader of the Opposition. To move that motion, I call the Shadow Secretary of State for Health, Heidi Alexander.
Thank you, Mr. Speaker. I beg to move the motion on the order paper in my name and the names of my honourable and right honourable friends. Mr. Speaker, before I begin, can I just inform the House that I have been told that the Parliamentary Under-Secretary of State, the member for Ipswich, will be opening this debate for the Government. Given that the House Secretary is sat next to him, can I ask why we won't be hearing from his boss today? If he'd like to explain a genuine reason, I'd be happy to take an intervention. But if not, I will take it that the Health Secretary simply doesn't want to come to this House to defend his policy.
Order. Order. A certain amount of chirruping from the Treasury bench and elsewhere on this matter. I simply make 2 points. First of all, it is, of course, entirely for the Government to decide which minister to field, but I do very gently say to the Secretary of State, and indeed to the Deputy Leader of the House, that to sit on the bench while these matters are being debated is one thing, particularly in the case of the Secretary of State, rather than to participate, but to sit there fiddling ostentatiously with an electronic device defies the established convention of the House that such devices should be used, and I remind members, without impairing parliamentary decorum. They are impairing parliamentary decorum and, in very simple terms, are being rank discourteous to the Shadow Secretary of State and to the House. It's a point so blindingly obvious that only an extraordinarily clever and sophisticated person could fail to grasp it. Heidi Alexander.
Thank you, Mr. Speaker. Of course, this isn't the first time that the House Secretary has chosen not to respond to debates that I have brought or questions I have put.
I say to the Deputy Leader of the House, put the device away, and if you don't want to put it away, get out of the House. It is rude for the Honourable... Order! It's rude. Order! I'm not inviting a response from the Honourable Lady. I'm simply telling her it's discourteous to behave like that, a point that most people would readily understand. The Shadow Secretary of State, Heidi Alexander.
Mr. Speaker, I think I will leave my comments on this matter there. Mr. Speaker, in the last few months, ministers and I have had a number of exchanges across this dispatch box about the unnecessary and dangerous fight this government is picking with junior doctors. You might think that having totally alienated one section of the NHS workforce, ministers would think twice about doing it again, but you would be wrong. Not content with junior doctors, the government are now targeting the next generation of nurses, midwives and other allied health professionals, podiatrists, physiotherapists, radiographers and many, many more. Instead of investing in these healthcare students, instead of valuing them and protecting their bursaries, which help with living costs and cover all of their tuition fees, this government is asking them to pay for the privilege of training to work in the NHS. Scrap the bursary, ask tomorrow's NHS workforce to rack up enormous debts and claim this is the answer to current staff shortages. I will give way.
I thank the Honourable Lady for giving way. She is making a spending commitment. Why then did she stand on a manifesto of opposing this government's £10 billion investment in the NHS only a few months ago?
Thank you, Mr. Speaker. The Labour Party has always been clear that it would have given the NHS every penny it needs. Mr. Speaker, you would think that the approach that I have outlined when it comes to healthcare students, most people would think that the government have taken leave of their senses, and they would be right. A few weeks ago...
my honourable friend, and I wanted to tell her that my constituents in Hull are baffled by the approach the government are taking at a time when our local hospitals are having to recruit nurses from Spain and other European countries. To actually stop bursaries to get more people into training seems to me absolutely ridiculous.
I absolutely agree with my honourable friend. Indeed, the bursary acts as an incentive to get those students into training and to get them into the NHS. A few weeks ago, the government launched their consultation on the technical detail of these changes, not the principle, just the detail. In his foreword, the Parliamentary Under-Secretary of State claimed that these proposals are good for students, good for patients and good for the NHS. The opposite is the case. But before I set out why these plans are so bad, it's important we remind ourselves why our country has a nursing shortage in the first place. Shortly after the 2010 election, the coalition government cut the number of nurse training commissions in an attempt to make some short-term savings. Those cuts saw nurse training places reduced from more than 20,000 a year to just 17,000, the lowest level since the 1990s. As a result, we trained 8,000 fewer nurses in the last Parliament than we would have done had we maintained commissions at 2010 levels. At the time, experts such as the Royal College of Nursing warned that the cuts would cause, and I quote, serious issues in undersupply for years to come. They were right, but they were ignored by ministers who were too focused on the short term and no doubt too distracted by their plans to launch a massive reorganisation of the NHS. Our health service is now suffering the consequences of those decisions. New analysis by the House of Commons Library, which has been released today, has shown that the number of nurses per head of the population fell from 6,786 per million people in 2009 to 6,645 in 2015. A Unison survey published just last week found that over two-thirds of respondents felt staffing levels had got worse in the last year, with a further 63% saying they felt there were inadequate numbers of staff on the wards to ensure safe, dignified and compassionate care. Because of these shortages, hospitals are forced to recruit from overseas or spend vast amounts on expensive agency staff. I will.
Thank my honourable friend for giving way. In the years 2014 to 15, £3.3 billion was spent on agency staff in the NHS. Does this short-sighted move mean that beleaguered trusts may actually be more reliant on agency staff as a result of removing the bursary?
My honourable friend is completely right to point out that the problems with staff shortages leading to more agency staff needing to be used are creating an enormous black hole in hospital finances, and my fear is that these proposals will put off the next generation of nurses. Madam Deputy Speaker, it now appears that the government is making some of the same mistakes all over again. A report sneaked out on the day this House rose for Easter recess revealed that the government has only commissioned 1/10 of the extra nurse training places experts said were needed this year. The report from the Migration Advisory Committee says this: "We were told that Health Education England has acknowledged that, on the basis of workforce modelling alone, they would have liked to commission an additional 3,000 places in 2016-17. Funding constraints meant that they had only commissioned an additional 331 places, 1/10 of what was actually needed." The report... I will give way.
Would the Honourable Lady not agree with me that by changing the way that we run the NHS, especially on this bursaries, and opening it up to more of a competition, we would actually get more nurses coming into the NHS, thus plugging the gap that she's describing?
I don't agree with the honourable gentleman, and further in my speech I will explain in some detail as to why. I'd like to go back to the Migration Advisory Committee report because it doesn't make happy reading for ministers, Madam Deputy Speaker. It goes on to say, "It seems self-evident to us that the reduction in the number of commissioned training places between 2010 and 2013 across England, Scotland, Wales and Northern Ireland was a significant contributing factor towards the current national shortage of nurses." And finally, the crucial sentence which sums up why we are experiencing across-the-board nursing shortages, almost all of these issues relate to and are caused by a desire to save money. But this is a choice, not a fixed fact. The government could invest more resource if it wanted to. Madam Deputy Speaker, those aren't my words, they're the words of the Migration Advisory Committee. Hospitals are short of nurses, mental health services are short of nurses, care homes are, hospices are, and primary care is too. We therefore have a big problem. No one in this House disputes that, but no one should be under any illusion as to the cause. The question is, when faced with this problem, what is the right thing to do? How best can government work with experts to ensure we are training enough staff and supporting those staff so they stay motivated and stay working in the NHS? I give way.
No, I'm grateful to her. And of course, we all agree that there is a significant shortage of nurses, and she's absolutely right to ask the question, what should be done? Is she therefore giving support to the government's concept of associate nurses, which I believe will make a huge difference in places like my constituency of Gloucester, where we need new nurses of this kind to increase the numbers of home-trained nursing staff?
I'm grateful to the honourable gentleman for his question. I think the key question that we need to have answered with regard to nursing associates is whether it's the intention of the government that they replace registered nurses, because if that's the case, I fear these proposals would be bad for patient care. Madam Deputy Speaker, you might think a sensible approach to trying to resolve this problem would be to sit down with the Royal College of Nursing and other trade unions, the universities, healthcare providers, to try and work out a way forward. But no, this government seems incapable of that. Instead, in just 2 lines in the Chancellor's autumn statement, they announced they would be scrapping NHS bursaries and asking student nurses to pay tuition fees. The Minister will argue that this will allow universities to train more students. But his problem is this. I will give way.
I thank my honourable friend for giving way. And doesn't she think the government should listen to the Royal College when it says these proposals they're putting forward are high risk, potentially deterring prospective students from entering the nursing profession and risks worsening the current nursing shortage?
Hear, hear.
I entirely agree with my honourable friend. I think the government's problem is this. They have failed to back up their claims with any evidence, and they are now faced with a breadth of opposition to this proposal, not just from members of this House, but from the Royal College of Nursing, the Royal College of Midwives and Unison, organisations such as Million Plus, the Association for Modern Universities, are also questioning the assumptions on which the government is basing this policy. So, I will do.
Does she agree with my constituent Zoe, who is trained to be a nurse herself, who is concerned particularly for mature students because she feels that many of them, that 50% of their time is spent on unpaid clinical placements in hospitals and in the community. Therefore, they don't have the opportunity to do part-time work to support themselves, as many others do. Is it not going to affect them disproportionately?
Yeah.
I do agree with my honourable friend, and I will make some remarks on precisely that point later in my contribution. Madam Deputy Speaker, the purpose of the opposition in calling this debate today is that we hope that this House can rally round what many people would think is a straightforward and reasonable proposal, that the government drops these plans and instead consults on how to properly fund and support the future healthcare workforce. Let me set out why these plans are bad for students, bad for patients and bad for the NHS. The government claim these plans will leave healthcare students 25% better off. But what they won't say is that according to their own consultation, in order to be 25% better off, a student will have to take out a maximum maintenance and tuition fee loan for 3 years and would graduate with debt of between £48,000 and £59,000. I will.
friend for giving way on that point, and many people in the House today will know that I had a son at 23 weeks gestation that spent 6 months in intensive care with a neonatal nurse called Nicola Probert, who sadly died not long after my son came out of hospital. I'm frightened, and I'm sure many people watching this debate are frightened that people like Nicola will not go into that profession because of these astronomical amounts of debt that they will take on. Does my honourable friend agree with me that really that's a regressive step and the government should think again about that?
Yeah. I completely agree with my honourable friend. It seems that the government's argument is students will be better off because they can borrow more. The simple truth is that loan repayments will hit the take-home pay of nurses. There's no two ways about it. The current starting salary for a nurse is £21,692, just above the student loan repayment threshold, which, of course, has been frozen. This means that nurses will start paying off loans as soon as they graduate. And according to Unison, based on current salary levels, a nurse will be faced with an average pay cut of over £900 a year to meet their debt repayments. How can that possibly be justified? And worse, as the average age of a student nurse is 28, the current 30-year repayment period means that many nurses will be paying off loans to within years of retirement. On this side of the House, we say it is wrong to burden the next generation of NHS staff with a lifetime of debt, and wrong to expect tomorrow's nurses to pay the price for this government's mismanagement of the NHS. Does the Minister not understand that student nurses, midwives and other allied health professionals are different from other students? Can he not see it is dangerous to assume that just because application rates remain stable after the trebling of tuition fees in the last Parliament, the same will happen with his proposals? I say to him that assuming healthcare students will respond in the same way as other students to a tuition fees hike is one hell of an assumption and one hell of a risk. Yeah. Courses for nursing, midwifery and other allied health professions are substantially different to most other arts and science degrees. Not only are the courses more onerous, fewer holidays, longer days and longer term times, but students are also required to spend about half of their time in clinical practice, 2,300 hours in the case of a student nurse, including night and weekend shifts as a normal part of their studies. I've already given way to the honourable gentleman, and I want to make some progress. Madam Deputy Speaker, these changes will effectively charge students for working in the NHS. And of course, longer term times and clinical placements also make it harder for these students to get a part-time job to supplement their income, as many other students do. But it's not just the course that makes healthcare students unique. They are much more likely to be women, much more likely to be mature students, much more likely to have children, and more likely to be from BME backgrounds. Many nursing students have already completed one degree and turned to nursing in their late 20s or early 30s. Indeed, the average age of a student nurse is 28. When I think of my own friends who are nurses and midwives, 3 out of 4 of them took the decision to retrain, having done a different first degree. Now, I know the Minister probably moves in different circles to me, but I can tell him that if he wants a dose of reality, I'm sure my friends would be more than happy to oblige. I understand that the Minister may not have experienced the same conversations as I did within my working-class family about the pluses and minuses of racking up debts to get a degree. But I can tell him that for many nurses, under his proposals, that will be an all-too-real consideration. For the 1 in 5 healthcare students with children, does he not realise that the fear of debt is greater for them than for a carefree, privately educated history student bound for Cambridge? Madam Deputy Speaker, my concern about these proposals is that we ultimately end up with those who are best placed to pay becoming nurses and midwives, and not those best placed to care. And that brings me to why these proposals are bad for patients. I'll give way to the Honourable Lady.
The honourable member for giving way. I think we are all agreed on the need for more nurses. The question is how we fund them. Will she advise how much money she would take away from frontline NHS care in order to fund the expansion of nurse places that we need in this country?
I'm grateful to the Honourable Lady, and at the last election we set out clearly costed plans for how we would recruit additional nurses, doctors and care staff to the NHS. Madam Deputy Speaker, the NHS should have a workforce that reflects the population it serves, just as this place should too. The mental health sector, in particular, relies on mature students and the additional life experience they bring to what is a very demanding environment. A few months ago, I met Marina, a young woman who hasn't had an easy life, but is now on a mission to become a mental health nurse. When Marina says to me that she thinks that some of the people best placed to care for others are those who have experienced hardships themselves, I think she has a point. And when she says she wouldn't have been able to start her training without the bursary, I believe her. Why is the Minister so convinced that the NHS can do without people like Marina in the future? And why does he think they should pay to train? And why won't he consider other options for increasing student numbers? Madam Deputy Speaker, the quality of training that student nurses, midwives and other allied health professionals receive will also be dependent upon the quality of their clinical placements. Whilst government ministers claim these changes could deliver up to 10,000 extra places over the course of this Parliament, can they set out what capacity hospitals and other providers have to accommodate these extra students, and whether Health Education England has sufficient funds set aside to fund these placements? Can the Minister also be clear as to how they have arrived at this 10,000 figure? Is this their assessment of what the system needs? Is it what Health Education England can afford to fund? Or is it simply a big-sounding number plucked out of the air at random? And an extra 10,000 compared to when? What's the baseline year from when to judge his policy by? I've now asked the Minister that question 3 times in written parliamentary questions, and each time I haven't got an answer. Does he not understand that if his department can't even answer a simple question about one of their key claims about this policy, then it doesn't exactly inspire confidence? Madam Deputy Speaker, there are so many questions the Minister needs to answer. It is impossible to do them all justice in just one speech. I will give way.
I'm very grateful to the Honourable Lady for giving way. As has been indicated, it's agreed we need to expand places, but thanks to this government, £10 billion additional pounds is being put into GP services, into acute services, into cancer treatment, into hospital care. Which of those services would she cut to fund the alternative bursary scheme that she has in mind?
Thank you, Madam Deputy Speaker. I'm afraid that the honourable gentleman doesn't seem to realise that that money is plugging a very, very big black hole in NHS finances at the moment. When the Minister stands up, I'm sure he will note that many applicants to study nursing and other healthcare degrees are turned away. But what proportion of those unsuccessful applicants actually meet the entry criteria? How can he be sure that his new system will deliver the required numbers of different types of nurses and other healthcare professionals in the right geographical areas? Can he also say what guarantees he has given to higher education institutions that the new arrangements will fully cover the costs of delivering degrees? And can he also say what assessment he has made of the amount of unrepaid student debt which will accumulate, given that over a lifetime some nurses will not earn enough to repay the totality of their loans plus interest? Madam Deputy Speaker, the The proposal to scrap NHS bursaries is a massive gamble at a time when the NHS needs certainty. Put simply, it shifts the cost of training nurses, midwives and other allied health professionals from the state to the individual. If we are all happy to enjoy the benefits of the NHS, why should we not all contribute to the training of those who work in it? Madam Deputy Speaker, I was the first person in my family to go to university. I was someone who had my tuition fees paid in full and received a full maintenance grant. I'm really worried that people like me, people like my friends, will be put off from what could be a fulfilling and important career. We should be doing all we can to inspire today's school children to become the nurses and healthcare professionals of the future. Sadly, the government is doing a very good job of doing the very opposite. If ministers want to continue to import staff from overseas, then they are going the right way about it. I say we owe a debt of gratitude to those staff, but we want homegrown staff too. Madam Deputy Speaker, in conclusion, I would just like to return to the government's consultation. One of the sections is titled Nursing, Midwifery and Allied Health Professional Students Deserve the Same Opportunities as Other Students. On this side of the House, we say no, they deserve better. They should be treated differently to other students, as they are the people who will look after us when we are older, who will care for our relatives when they are sick, and who will staff the NHS when this shambolic government has long gone. The government should drop these proposals and think again. I commend this motion to the House.